Well, with more, we're now joined by Alberta's Health Minister Adriana LaGrange. Minister, thank you for being with us. Really appreciate the time.
My pleasure. Thank you.
Now, the Premier says, as it is, AHS was not setting up Albertans for success. How does this new structure change that, do you think? Will it actually bring things about like primary care for Albertans or reducing waiting times?
Well, absolutely, because I wouldn't have brought it forward if I didn't think that that would actually be the case. What I was seeing is a lack of structure within AHS. It had gotten beyond its scope, what it was originally intended for. I've spoken to previous ministers of health who indicated that really when it was first formed, it was about looking after acute care, which is the hospital system. And unfortunately, it grew beyond that and beyond its ability to manage all of the different moving parts that it was looking into. So, and I'll give you an example, because currently AHS oversees roughly about 20 to 25% of continuing care, but it holds all the contracts with all of the other continuing care providers. So it was a bit of an inherent conflict of interest that we need to correct.
Okay, now to my understanding though, and correct me if I'm wrong here, this overhaul could cost as much as $85 million. Would that money have been better invested in creating more medical schools, hiring more healthcare workers, or better compensation packages to attract people into the healthcare industry?
Well, we're doing all of those things, Michael, already. We've allocated tens of millions, hundreds of millions of dollars to workforce strategies and improving the overall healthcare system as a whole. We've added approximately $1 billion over the next 3 years to continuing care. But what those dollars that are allocated, and in fact, I have to correct the record, because the dollars that have been put out there as a possible cost for this transformation is just that. We wanted to make sure that we had funds in the event that we needed to utilize them as we set up for organizations, et cetera. But we used the cost of the 2008 transformation to AHS as kind of a guideline moving forward. So really what we're looking to do is make sure that we have 4 structures that are laser focused on providing quality care in primary care, continuing care, mental health and addictions, and of course, acute care.
Okay. Now, you're also, according to reports, looking at selling off the Capital Care Group as well as the Care West entity as well. And, you know, it had me thinking about Ontario, because Ontario back in the 90s, as you know, privatized its nursing and long-term care homes. That was a way to improve healthcare at the time, but COVID proved that disastrous, because that is where Ontario saw the majority of COVID deaths. How will you navigate those concerns about privatization, about selling off those entities, and the outcomes that they will create?
Well, the information that the NDP shared was inaccurate. They had a document that was an early draft of recommendations that were brought forward to me. I, in fact, kiboshed those recommendations because really AHS is providing service to those continuing care residents. But the inherent conflict of interest, where they are both a service provider as well as holding all the contracts with the other continuing care service providers, makes it really difficult in that space. So what we're looking to do is set up an organization that will oversee all of continuing care. We have another acute care provider, which is Covenant Health, who also has continuing care spaces that they look after. So I see this as AHS being able to do both acute care and continuing care, but they will no longer be both a service provider and a procurer of services.
And what about concerns about increased privatization as you look to overhaul how healthcare is delivered in the province? Of course, that is a continuing issue, whether it's in Alberta or Ontario or British Columbia. How big a role, rather, private providers will actually play?
We have been very clear that we are not privatizing healthcare. We have a excellent healthcare system in the terms that it is publicly funded. It's publicly funded public healthcare. We are not going to change that, but we do know that there are opportunities right across the province to be innovative, to be creative, and to do things differently. And I'm hearing from doctors, nurses, frontline workers that are telling me this change is long overdue. and they are excited about the possibilities.
At the end of the day, Minister, what will tell you that this reorganization has been a success? How will you judge that?
Well, I will judge it by the fact that there will be improved services to everyday Albertans. Albertans, once again, will be at the center of the decision-making. They are the patients, they are the customers, and we will provide excellent customer service. And the other area that I really want to see and great focus put on is that our healthcare workers are valued, that they have a good work-life balance, that we are able to attract and retain the best healthcare professionals. We have some of the best healthcare professionals in all of Canada, in all the world. I want them to stay here in Alberta, but I also want to attract more because we know we need more.
Minister LaGrange, I know it's been a busy day. Really appreciate the time this evening. Thank you for that.
My pleasure. Thank you.